Again, Jeff Clark here, Regional Director, GoldenCare USA. I'm going to go ahead and just kind of introduce you. It is 10 o'clock. Maybe we can get rolling. For coming on board today, we're going to be going over the Mutual Omaha Med Subs. We have Jason Weber, the Sales Director for the Medicare Supplement Department here at Mutual Omaha. He's one of our contacts. He came up here recently and went over just a bunch of neat stuff with Mutual Omaha Med Subs this fall. And we just thought it'd be a good idea to share that with all of our brokers. So, again, without too much to do here, I'll introduce you to Jason Weber with Mutual Omaha. He's going to be going over, again, Mutual Omaha's Medicare Supplement, all the promotions and things they're doing to have a good season here. So, Jason, go ahead and take it away.
All right, thanks a lot, Jeff. I really appreciate it. Thanks for giving me the opportunity to hop online.
Yeah, you're good.
And so I guess just to start, I want to talk about the fact that MedSup is a commodity product, right? If you're marketing let's say a long-term care policy or final expense or like an IUL or something like that, those are products that are a lot different. The sales process is a lot different for something like that relative to a Medicare supplement. And for a very simple reason. All MedSup plans, as I'm sure everybody knows, they're standardized. It's a commodity product. The fun little analogy that I like to use is when you go into the grocery store and you're buying a gallon of milk, why are you buying one brand over another? Does the milk on the left taste that much different or better than the one on the right? No, milk's milk, right? What you're trying to do is you're trying to save a quarter. If your client is looking at Plan G is going to look and feel and operate the exact same way, whether your client buys it from Mutual of Omaha or Aetna or Cigna or United Healthcare or Blue Cross, any of those companies, right? From a coverage standpoint, the plan is exactly the same. So why should your client buy their MedSup policy from our company? That's kind of the things that I want to walk the group through today. I want to talk about some of the levers that we're pulling as a company to encourage agents to write more of their business with Mutual of Omaha. We'll talk about where the price is most competitive, kind of like that milk analogy I just went through. The selling process is very much the same as it is with our little example that we use. If your client is interested in a Plan G or a Plan F or a Plan N or any of a number of other plans that are available on the market today, and because the coverage is the same, why should they pay more than they need to, right? So we'll talk about where our price is competitive. If you are especially focused on the Medicare market as we approach the fourth quarter with AEP, it's a huge prospecting opportunity for all agents out there, whether or not you focus on the product. If you are focused and you are wanting to take a hard look at Mutual of Omaha MedSups this season, you should absolutely focus your prospecting efforts on where we have competitive rates, because if you're not, you're obviously not going to be as efficient in doing that. So we'll start the conversation there, but I do want to talk about some other things, and again, I just touched on it a few seconds ago. These are some of the things that we're doing as a company to encourage you to write more of your business with us. We have some pretty fun marketing and incentive programs. As a company, if we're asking you to give us your business, hopefully we're a good company to do business with. Those are some of the levers that we can pull too that sometimes fly under the radar. If you submit an app to an insurance company, but that thing sits in underwriting for a few days, your client doesn't have coverage that they most likely need and need soon. You're not getting paid on that policy. So hopefully your experience with our company has been good. I know that's not always the case, but hopefully generally speaking that has been the case. And we want to be an efficient company to work with. If you have a question on a policy, maybe you didn't get paid on that, or you just have a general question, if you call us up and you're on hold for 40 minutes before someone picks up the phone, are you going to be reluctant to work with us in the future? Probably. So, some of those things, I don't have slides dedicated to those, but I definitely wanted to touch on that. That is very important too. So we take a lot of pride in the fact that, we are good to work with, and again, hopefully you've had a good experience. Before we dive into the pricing and some of the product stuff, I just wanted to talk in general about Mutual of Omaha as a company. And specific to MedSup, who's buying MedSups today? These are baby boomers, right? These are people that grew up in the the 50s and the 60s and maybe, even the 70s a little bit. And, these are people that now that they're entering the retirement phase of their lives, it can be a little stressful, right? It's different. Hopefully they've done a good job of building that retirement nest egg. They want to live a certain lifestyle, and hopefully they've done everything they had under their control to enjoy that lifestyle. But it's stressful because it's new, and they are now living on this limited income. So if they're getting their health insurance through a health insurance company, they want to make sure that coverage is affordable, and it's going to remain affordable for at least the short to midterm, right? The average med sub stays on the books for about 7 years. So this is important information to share with your clients. There's a lot of competitive rates out there. It's a very competitive market these days. But we want to make sure that we're showing our clients that Mutual Omaha is an A-rated company. We've been in this market as long as anybody has. We've been offering med subs for over 50 years now. We have a lot of experience. We're pricing these products as competitive as we can, but also taking into consideration that we want to maintain that affordability for at least the next several years. So the rate increases, we'll talk about that a little bit after we go through the new business rates. But this is important information to share too. We have A ratings across the board, so definitely make sure you're talking about that with your clients when you're going through all of the different companies that you represent. And then kind of touching on that baby boomer thing once again. So if you ask someone that is a baby boomer, what's the first thing that comes to mind when you think of Mutual of Omaha? They're probably going to say the Wild Kingdom, right? That's a partnership that has done some very great things for us as a company from a brand recognition standpoint. And the people that are most familiar with Mutual of Omaha by way of the Wild Kingdom, well, these are the people that are buying Medicare supplements today. So this is a very, I think, easy suggestion to make to our clients when are looking at all of the various rates and companies that we're contracted with. They want to place their business. They want to buy a product from a company that they know and that they trust. And Mutual of Omaha is definitely right at the top of the list as far as that goes. And then just a few other things. I don't want to talk too much about this slide. I really don't think the numbers, tell too much of a story. You can kind of read through that on your own. But I did want to highlight this middle bullet right here. We're the largest agent-sold med sup carrier. So we talked a little bit about, why your clients may want to take a hard look at Mutual, but now we're going to switch gears and talk about from a producer standpoint. So from your perspective, from an agent. United Healthcare, they're the elephant in the room, right? They're a monster. They're huge, and they're a good company. We're never going to catch those guys, but I really don't think we want to. They've really grown as a company by marketing directly to consumers. That's why you see so many United Healthcare commercials on TV, especially this time of year, right? Well, we're the largest agent-sold carrier, and that's another thing I take a lot of pride in. Everything that we're doing as a company, we're doing to encourage you to place more of your med sup business with us, as I've mentioned several times already. And if you can grow and build your book of business by writing Mutual Omaha med subs, well, we're going to grow as a company as well. This is how we've grown our distribution. It's by partnering with agents just like yourself to grow your business. And if we can make an improvement to our e-application to make it easier to submit business to us, if we can make improvements to the various service departments in our home office, like I mentioned before, underwriting, compensation, policy owner services, any of those types of things, well, we're going to grow because you're going to be placing a premium on recommending us to your clients. At least that's the hope, and that's the intention. So I just wanted to touch on that really quickly. That is something that has served us very well over the years, and hopefully you can continue to experience those types of things. Let's talk a little bit more about the products that we have available across the country. So here is a look at our plan availability by state. There's a few things that I want to touch on here. First of all, the color. So if you look in the bottom left-hand corner, you can see that we offer our med sup products, not just Mutual of Omaha paper, but we also have 3 what we call affiliate companies, and that's United of Omaha, Omaha Insurance Company, and United World. And I think a newer agent may ask, why do we do it this way? We just talked about how, seniors love the Wild Kingdom and they know Mutual Omaha because of that, but they get their policy in the mail and it says Omaha Insurance Company, for example. And that's just another hurdle that I have to jump over to say, no, Mr. and Mrs. Client, you did buy a Mutual Omaha product. This is just one of their affiliate companies, like I just said. But why do you do that? Well, it really comes down to keeping our prices as competitive as we can make them. Let's take a look at Texas. Texas is a huge state for us. There's a lot of sales that come out of that. If you're not writing in the state of Texas, take a hard look. There's a lot of seniors down there. It's a great place to retire to. It's a huge state, of course, just from sheer population. And we have very competitive rates. Well, we have this product today on United World paper. We released this product late last year. I think it was about halfway through the summer. And before that, it was Omaha Insurance Company. Well, messed up, it's a very cyclical market, right? Any company is going to release a product. Sales are going to be hot right out of the gate, but due to the block getting older, claims costs are increasing. We have to release a rate adjustment just to ensure that we can continue to pay those claims. And so after 3 or 4 or 5 years, you're looking at 3 or 4 or 5 or 6% rate increases each year. If you're looking at a quote tool online, that Mutual Omaha product is slowly going to work its way down to the point where it's just not that competitive anymore, and it's really not in your best interest to market that product in that state. So what can we do as a company? We can release a new product, and in this case, on a United World paper, and we have not had a United World product in the state of Texas before. So we don't have an active block of business where we're paying claims that we have to take all of that data into consideration when we're pricing it. So it's essentially a fresh start. We can go right out of the gate with very aggressive premiums and hopefully get a lot more business in which we haven't received a whole lot of that. Okay, so that's something we're doing as a company. I just wanted to explain it to the group today. Pay attention to the states in which we release new products in, because that is a very strong opportunity for you to go back in there. It may be a place that you're actively marketing. Maybe it's a place that you live. Maybe it's a place that you don't live. But that's a great thing about MedSup is you market this product coast to coast. You don't have to meet face-to-face with your clients. If you live in an area in which we don't have especially competitive rates, take a look at where we do. You can submit that business to us electronically. You're not going to miss a beat, and you can continue to grow your business that way. So that's the one thing I want to mention. The other thing really quickly here is either the 12% like you see in the state of Kansas or 7% like we see in Colorado. That's our household discount. Okay, and again, this is a commodity product. It's largely based on price, and if we can shave 12 or 7% off your client's annual premium, well, that's a very important thing to look at because that's obviously going to help us to get more sales. That discount is tied to household living status. Okay, and if you take a step back, I think I jumped the gun a little bit. The reason we have a discount tied to household living status is because those are the healthier people that are living out there, and we obviously want healthier clients. If you can give us more of your healthy clients, well, that's more profitable business for us. That keeps rate increases down in the future, and that's really good for everybody, right? So if we can tie that discount to the healthier people that are living out there today, and we take a look at, there's a lot of research out there that shows if someone lives with either a spouse or a domestic partner or just someone that they care about, they tend to be active, more active, they tend to eat better, they just tend to be happier individuals out there. So that's why the discount that we offer, and a lot of MedSup carriers these days are offering a discount tied to the household living status. The 7% is our older one, so let's just focus on the 12% for right now. Not only is your client going to be saving a little bit more money with a 12% discount, but it's also a lot easier to qualify to receive. Here, we're just looking at cohabitation. So if your client who's filling out the app either lives with a spouse or a domestic partner at the same address, they qualify for the discount. If you look at the 7%, that's what we call a two-policyholder rule. So for your client to qualify for that one, they have to be living with another Mutual of Omaha MedSup policyholder. Okay? With a 12%, that's not the case. We're just looking to see if they live with a spouse or a domestic partner. If they can say yes to that, very simple, then we can add the discount. It's really important that you ask if your client does qualify, because if you're quoting various companies' rates and you can tack on a 12% when other companies offer a 5 or a 10 or a 7%, well, that's obviously a very good thing if you can offer them even a further discounted price through our company. And I mentioned spouse or domestic partner. It actually doesn't just end there. Let's say your client lives with a sibling or something like that. They can qualify that way too. It's just that if they're not in a marriage or in some sort of domestic partnership, i.e. a sibling, then we ask that they're either 60 years old, the person that they're living with, and they've lived together for the previous 12 months. Why do we have those additional requirements for this scenario? Well, that is simply to ensure it's the type of business that we want. Again, this is designed to encourage you to give us your healthier clients, and we're trying to avoid the situation where maybe they live with like a live-in caretaker. That could be someone that's 25, 30, 40 years old. There's obviously not a some sort of friendship or intimate relationship with that person. And if they have a live-in caretaker, they're probably not the healthiest people out there. We're trying to kind of exclude that type of business from this pool, okay? So again, spouse or domestic partnership, living together at the same address, they qualify. If it's not a spouse or domestic partnership, then we're looking at 60 years old, living together for the previous 12 months. Okay? I'm going to go back one slide. After the end of this call, I'm going to send Jeff a copy of a few PDFs that are included in this presentation. This is one of them. On the back of this flyer are some further details on how your client can qualify for that 12% household discount. That's really good to review because if you can help your client to understand how it works, how to qualify for it in a sales appointment, I think it's going to be a little bit easier for you. So I'll do that at the end of the call. Okay, so let's talk about rates. So here's a look at where our prices are most competitive all across the country. The dark blue, the navy, that's where we offer the lowest rates versus all MedSup carriers in that specific area or zip code. And then you can see in the bottom right-hand corner is that little color scale. As you get to the warmer colors, we really don't have competitive rates. So if you live in a state like New York, for example, well, you're probably not going to have a whole lot of luck. But again, that's why you can and should focus on other areas of the country. You can market this thing in other areas where a face-to-face interaction with your client isn't possible. Submit that business electronically, like I said before. But here's a good look at where we offer our most competitive premiums. And just kind of a brief note here, I mentioned this before, we release new products in a number of states all across the country. This last month, we released products in North Carolina and South Carolina, Michigan, and Missouri. Okay, so keep an eye on where we're releasing new paper because we're once again going to be able to offer you competitive prices for your clients. I want to touch on the rate increase history, and I feel like a lot of people in my position are reluctant to do this. But again, we're talking about people that are buying this product today. They're now retired. They're living on a limited income. Every penny is absolutely important, right? So not only should we be able to offer them competitive rates right out of the gate, but if that price is going to jump 10 or 12% in policy year 2, well, what's the point, right? And you're going to have a very unhappy client on your hands. So this should absolutely be part of the sales conversation again. This is just our national average. If you go onto our broker portal, that's Sales Professional Access, you can take a look at all of the breakdowns by plan and by state. Okay, so again, this is just the national average. Go onto our website and you can take a look at the specifics. Just a few other things on the product side, and then we'll jump into some of the other things that we're doing to encourage agents to write more business with us. But I want to talk about Plan G. So Plan G, if you're not writing it today, hopefully now you'll take a little bit more of a hard look at it. This is where we offer our most competitive prices. Okay, our Plan G is far and away our most competitive plan. You also see a little bit lower rate increases on the Plan G just because we don't offer a guaranteed issue right in most cases, not in all, but in most cases on it. So this is just a really simple sales idea. I'm sure a lot of people have heard of it before. The idea here is that Plan G may be in your client's best interest because it can save them more money. A lot of people buy Plan F. Plan F is the most popular plan available today. And for good reason. It provides most complete coverage. There's virtually no out-of-pocket expense. And if your client can afford it, why would they not go the Plan F route? Well, if we take a look at Plan G a little bit below the surface, and you take a look at the annual premiums, Plan F, more complete coverage, so it only makes that it's more expensive. We're looking at about $1,800 for the F versus $1,200 for the Plan G. The difference between the two, G doesn't cover the Part B deductible. This is deductible to $183, so we add that to the Plan G premium. Well, we're still looking at only $1,400 for the G, $1,800 for the Plan F. That's an annual cost savings by going the Plan G route of almost $400. Okay, so again, even though there's more out-of-pocket expense with the G, long term, take that out a little bit. Your client can save more money. That's not always the case, but in a lot of cases it is. And a really simple way to say it, why would your client buy something that's going to save them $183 when they're going to pay another $387 for it? Okay, that's the difference between the F and the G. And again, that's where we offer our most competitive rates. And then a few value adds that we offer with our MedSup products. I'm going to go through three of them. These are strictly free services that your client is automatically enrolled into when they purchase their Medicare supplement policy through Mutual of Omaha. And here's a look at the flyer for this one. This is called the iMed Vision Care program. They receive this flyer in their policy output, and they're designed just to, like the name implies, add more value in hopes that these are services they can utilize. And the idea here is that they'll hold on to their policy longer. It increases persistency. A policy that stays on the books longer, obviously that's a good thing. That's more renewal income for you, etc. So how this one works, this is discounts on all things eye related. Okay, so you can get $50 eye exams, discounts off of frames and contacts. Here's a look at the flyer again. iMed is a third-party company. It's just a company that we partnered with for this, this relationship. It's not available in all states. We have excluded these. We're not picking on these states. It's just that these states don't allow value adds. So any company won't offer value adds on their MedSup products. But check it out. A lot of seniors have glasses or contacts, right? So a lot of people are utilizing this program, and this one's been very well received. The second one is Amplifone. This is the same sort of thing, just with hearing aids and hearing services, those types of things. Again, here's the flyer that comes with the policy output. They can get discounts on hearing aids. I'm sure everybody knows hearing aids are super expensive. So we'll match a quote for a hearing aid that your client has through another provider, and we'll offer an additional discount of 5%. There's a risk-free 60-day trial on hearing aids, so if they decide they don't want them, they can't afford them, they're uncomfortable, something like that, they can send them back, get a refund. Free batteries for up to 2 years. There's a coupon that's included. It's actually in the flyer that they can cut out right here, and the state availability is the same. The next one, or the last one I should say, is Hospital Choice Savings, and this one is a little bit different. This one is pretty cool. So we released this last year in June, I believe it was, and we went around to a whole bunch of Part A facilities all around the country, and we asked them if they wanted to be included in this network. And Part A facilities, hospitals, skilled nursing facilities, assisted living facilities, things like that. Any facility that's going to provide Part A services. And if they said yes, well, that obviously is going to push more business to their facility, and in turn, what we get out of it is that facility agreed to waive the Part A deductible. I'm sure everybody on the phone knows that all MedSup plans cover the Part A deductible. It's about $1,300 a pop, so we save a whole bunch of money on the claim side. We pass some of that cost savings off to the consumer, so that's really the client's buy-in here, and we do that through this $100 premium credit, okay? This premium credit can be earned each benefit period. It's not an annual thing, once a year only or anything like that. It's each benefit period, and it's itemized on their next billing statement so they can see exactly what it was for. So that's your client's interest in this program, but we save a whole bunch of money. In fact, just a little over a year now we've offered this program. We saved over $5 million on claims costs. So that's money that we bake back into the product line that goes to help combat future rate increases. That's different, incentives and things like that, some of the fun stuff that we do. So this has been a very good program for us. There are some questions on this. So MedSup's one of the primary reasons to get a MedSup, perhaps over an MA plan, is that there is no network, right? And I just said that there's a network for this. Well, your MedSup policy is still going to work like it always has worked in the past, okay? There is no network with a MedSup. So if they live in Texas and they go up to Michigan to see the grandkids or whatever, that MedSup plan will still work, provided the doctor that they're going to see agrees to be paid by Medicare, right? That's kind of the one thing there. But if they go into a facility that's included in this program, that's where they have the opportunity to receive the premium credit, okay? So they can still go to any facility. If the facility's not included here, they don't have the opportunity to participate with this, but if they do, that's when they're going to see that. It is a relatively new program, so go and check out the list of facilities that are included. You can do that with this link right here. It's very good in some states, and it's not so hot in others, just being honest, but it is growing. We're continuing to add new facilities to it all the time, so definitely check that out before you mention it to your clients. And now we're going to switch gears and talk about a few incentives. I have just a few more minutes with you guys, and we want to make sure we answer questions. We've got about 10 minutes left here. We do an annual agent incentive trip. It's called Mutual Sales Leaders. Next year we're going to Ireland, which we're really excited about. You can qualify in a number of different ways. We're talking about MedSup today, so I'm just going to cover that right now. And here you can see that you need 225,000 production credits. What is a production credit? It's essentially $1 of annualized new business premium, ANBP. That's kind of the one measure that we use here in our home office. So think of when you first sell a policy, the annual premium that we're going to charge to your client. The average case size is around $1,500. Well, if you write one policy, you get 1,500 production credits that are going to go towards qualification for this trip. You need 125,000. I think that's about 175. I think I did that math before, and that's what it worked out to. So you get one credit for each MedSup. If you do any internal or affiliate conversions, that's where, like, again, in Texas, we had OIC before. We released United World with more competitive premiums. That would be an affiliate conversion. So we only give you half credit for that business because it's technically not a new client for us, a new policyholder. But focus on that new business, and in most cases, you're going to get one production credit for each dollar of premium that your client's paying. The marketing credits is up next. This is a pretty cool program because, as far as I know, we're the only carrier that offers something like this, and it's essentially money that you can use for marketing-related expenses. It's money that we're going to give to you if you write at least 5 MedSups in a month, and you can use that money and reinvest it back into your business to grow. When you first got into this business, it's tough to get off the ground, right? A lot of people wash out just because they're not making any money and they need money to grow their business. It's a lot of gas in the car. You need to buy a laptop and you need to buy leads and you need to put a marketing campaign together. There's a lot to it to get your name out there, to meet with clients. And this program is designed exactly to take care of some of those things. So again, write 5 med subs in 1 month with Mutual of Omaha, and we'll take a look at, again, the ANBP that those 5 policies generate. If you're submitting that business to us on the e-app, we're going to give you 1% of that total figure in marketing credits. So you can easily see 30 to 50 to 75 provided to you in 1 month's time, and they do accumulate from month to month. That'll continue to grow. You can check your balance on our website. Again, that's Sales Professional Access, and then you can use them for all types of things. So if you want to buy a new iPad, submit that receipt to us. If you have a marketing credits balance, you can use that to reimburse you for part of that expense. If you want to buy any merchandise off of our website, you want to take a client golfing, and you want to get some Mutual of Omaha golf balls, well, you can use that to pay for those. I think the most popular reason these are used is for lead reimbursement. So if you go through a third-party lead vendor, submit that invoice to us. Again, marketing credits balance, you can use that to reimburse yourself. They do expire, so just be careful of that. Anything that was earned up to September 30th, so just a few weeks ago, those are going to expire this year on December 14th. Anything earned after October 1st, those you're going to have until December of 2018 to use. So take a look at that. This is a flyer. Again, I'll send this as a follow-up after the presentation today. That way you can read through that program in a little bit more depth. This one is brand spanking new. We just released this on October 1st, so just a couple weeks ago. And this is our broker bonus program. So if you write, again, 5 apps a month, and we're going to pay you additional cash for each of those issued policies. If you're writing underwritten business, we love the underwritten business, of course, because that tends to be healthier people out there. They're going to claim less often. We're going to pay you $200 in addition to the traditional comp that you would normally receive. Okay, that's not being reduced in any way. This is all bonus income for you. If you write an open enrollment app, we're going to pay you $50 in addition to that. It's only available on plans F, G, and N, and only in these states. And we're doing this just through the AEP selling season. We're extending it out a little bit, so January 31st you can see right here. But we're really excited about this. Here's a look at the flyer. We'll send this out after the call again. But take a look at this. If you really focus on med subs, time of year, this is a really good way to see some money add up pretty quickly for you. So real excited about that. And now we're going to really switch gears, and we're going to talk about a different product altogether. But we're really excited about this. We've not offered a dental product before, and we just released this. So we have a whole bunch of new stuff to talk about today. But we're really excited about this, like I just said. If you haven't focused on dental before, but you are focused on the senior market, so if you're writing MAs or med subs or PDPs or anything like that, dental is absolutely something that you should be talking to all of your existing clients and new prospects about, for the very simple reason that Medicare does not cover most dental services. Unless your client is getting dental work done in a hospital room or something like that while they're in an inpatient facility, dental isn't going to be covered. They need a standalone dental insurance policy, and that's what Mutual of Omaha is now offering. So the fact that you can offer a dental product through a household name branded company like Mutual, I think is a very good thing.
I'm working this one right now.
Real excited about that. I'm going to see if I can mute the phones real quick.
Over to
I can't figure it out. But if you can hear me, the phones are not on mute. We're getting a little bit of feedback.
Yeah, we're having some trouble in this teleconference line with going to presentation mode, which normally is *5. So if anyone out there, just if you're trying to mute your phones or help us out here, if you have we're hearing some background noise, so mute whatever you can, or just try to help us get through the last couple minutes.
Yeah, we're almost done. I apologize for other people on the call. Okay, so just a few quick basics on this. So this product, while I said it's great for the senior market, the issue ages are going to go from 19 to 99. So if you have younger folks out there, they're 40, 45, whatever, they're interested in the product, you can sell them a Mutual of Omaha dental insurance policy as well. It's a guaranteed issue product, so we're not going to ask any health questions. Pretty much if they're interested and they say yes, well, you got a sale. So real quick that way. It's a unisex rated product, so it's not like we have a male rate and a female rate. Everybody's going to pay the same, and it's community rated, so it's not based on age. So the same price that a 65-year-old, your 80-year-old client's going to pay that same price as well. So it's very good, especially for the senior market crowd. And it is being offered through a passive network. The name of the network is Dentamax Plus. There's about 375,000 individual dentists included in the network. It's nationwide, very good network. Check it out. I should have put this on the slide, and I didn't, so I apologize. But write this down. Go to the website, dentistforme.com, and that's dentist plural, okay? So dentistforme.com/Mutual of Omaha. That is a website where you can go and you can search by zip code, you can search by dentist name, you can search by office name. If you search by zip code, it's going to plot it on a map for you so you can see all of the individual office locations in your area, in your client's area. So go ahead and take a look at that. And again, this is a passive PPO. So if your client wants to continue seeing their family dentist that they've seen forever, and that dentist is not included in this network, they can still use this policy at that facility. It's just that that dentist may not have agreed to the pre-negotiated cost, so there may be some higher out-of-pocket expense for them, but they can continue to see that dentist if they wish. And then here's a look at the two plans that we have available, the preferred plan and the protection plan. I had put this together myself, and it was a little difficult for me to see the differences between the two. So that's what the red is. The red is simply the differences between the two plans. So you can see the estimated cost. We'll just focus on the preferred plan right here. We have been, this product's been available for about a week now. We have already over about 200 issued policies, so it is being received very well. So if you haven't looked at it yet or you didn't know about it, hopefully you're taking a good look at it now. And the preferred plan is about 60% of all the issued business. So it looks like it's a little bit more popular so far. Just a few competitive points I want to make on this. There is no waiting period for either preventive services or basic services. So if your client wants to go in day one of the policy and get a filling taken care of, fillings are covered under basic services, they can do that. There is no waiting period for basic services. For major services there is, and you can see that right down here at the bottom. It's a 12-month wait for major services. And then also, both policies are going to cover implants. So there's a $3,000 lifetime max for implants on the preferred plan and $2,000 on the protection side of things. And you see that more dentists these days are suggesting implants as opposed to fillings. So if your client is being recommended to get an implant and they're asking if this product covers implants, you can say yes. So real excited about that, and that's been being received very well so far. Just a few other things. I'm going to start down here at the bottom. We have a vision care rider available as well. So the base policy is dental. You got to go dental, but if they want to add vision coverage, they can do that as well, and they can do that via the rider that's available here. It's about $8.28. So take a look at that. You can add it on. It's on the paper application as well as the e-app. Very simple to do. And again, it's a GI product, so it's a very quick application process. The discount plan up here, this is not yet available. We're looking at first quarter 2018 for this. And this is not an insurance plan. So if we go back, your client says, you know what, I really need dental coverage. This looks great, but it's kind of out of my wheelhouse right now. I can't afford it. What else do you have? Well, we have a discount plan. Again, it's not available yet. It will be soon. We're looking at about $10 a month for this one, and they just receive a discount card in the mail, and they can get 10 to 40% basic services that you see right here off of the total bill. Okay, so there's probably quite a bit more out-of-pocket expense here, but if your client doesn't see, at least in the short term, a big need for dental services, and if they can't afford something that's a little bit more pricey on a monthly basis, well, the discount plan may be a good option for them. Here's a look at the state availability. So again, it's a new product, not available everywhere yet. We did file the product in all states except for Massachusetts. That's why that one's blacked out. But any additional approvals, we're just waiting on those at this point. If they do, then we're going to install these in a lot of the great states that you see on the map right here.
Year number 2.
And then here's just another look at the flyer. We'll go ahead and send this one out as well. This is just a prettier view of the chart that I had put together, but this is going to walk you through the 2 plans that are available. And here's a look at the other marketing materials that we have. So this one is like an 8-page brochure that you can, show to your client in a face-to-face appointment. It kind of talks about the need, goes through the plan designs, it goes through the prices. It really just helps to facilitate the conversation that you're having with a client in an actual appointment. And then on the prospecting side of things, here's a prospecting letter. It's already been pre-approved, so you can order these through our sales support department. We'll print your contact information up here, so you can order 200 or 500 of these or whatever you want. Put a nice marketing campaign together. I'm sure everybody's thinking about marketing plans for the first of the year already. So go ahead and do that and follow up with a phone call and get some dental sales. And then this one over here is a postcard that we have available. Again, we can print your information on this and you can mail this out. Any marketing order that you do with us, we'll print these for free for you up to 5,000. So hopefully you're taking advantage of that. We'll print them full color, nice glossy paper and all of that. We'll ship them to your office. You would obviously just have to address them and pay for postage out to your prospects that you're sending them to. But the printing on our side is completely free for you. So definitely take advantage of that if you haven't. Okay, so that's all that I have. My name is Jason. It was good to be with you, everybody, today. And I'm not sure if we're going to open it up for questions, but if we are, more than happy to take those right now.
Hey, Jason, I just read a couple that were on the thing. There's a couple people asking about the average price of dental plans.
Yeah, I'm sorry, I didn't touch on that. That was on the slide, so we'll just go back real quick. It is state-specific, so this is just some general numbers. We're looking at about 40 to 50 per month for the preferred plan. That's kind of like our Cadillac plan, we've been calling it. And then 25 to 35 on the protection side. So we have a rate book that we put together. I can send that out afterward as well, and you can send it to all the attendees. That way you can take a look at the specifics.
Okay, thanks, Jason.
If they do, go into one of these salons.
Any other questions?
Yes, I have a question. How does your Mutual of Omaha plan stack a Senior Gold in Minnesota?
How does it stack against the Senior Gold? That one I'm not familiar with. Is that a dental policy?
Blue Shield, there's Plan F is going to stack up against that one. If you're talking Blue Cross Blue Shield Senior Gold, extended basic care, it's a little different than the rest of the country in Minnesota. So I would say compared to Plan F, they're pretty similar. Where Plan F's a lot less money.
I'm working this guy here. He was in yesterday. He's an airport guy. He's a vendor here. And he's working at Humana. And I've got his primary care doctor.
Anything else? I don't think he's talking to us.
Hey, again, I want to apologize. We've been having some trouble with our teleconference line, Jason. I'm not sure why we can't. Normally we can mute that interference out, and so we had this happen a couple times this week, and last week. So we're
no worries. It's fine. It happens.
Yeah, put our phone number on there, Jason, and just have them call if you have any questions. We got 3 marketers, a couple directors ready to answer any questions. So just throw our 800 number. There's yours. Yeah, go ahead and call Jason as well.
Yeah, I'm sorry. I don't have your guys' numbers on here. I should have put that on here. I apologize. Do you want to go ahead and say that to the crowd real quick?
Yeah, give us a call here at GoldenCare. If you have any questions or want any of these flyers, we'll get them from Jason. We can share any of the stuff you saw today with you. Number is 800-842-7799. And again, thanks for coming on today. I know we got a good crowd. I just want to thank you guys for taking the time to to talk about Medicare supplements with us.
All right, thanks everybody. Have a good day.